MDs don't practice medicine. They practice allopathic medicine. And allopathic medicine is fantastic for trauma care, surgery when it's necessary, childbirth, dentistry, things that are reductionistic in nature. But when it comes to treating chronic illnesses, things that most people go to the doctor for most of the time, MD-directed allopathic medicine, it's a failed methodology. Because the medical doctors, in point of fact, your medical doctor may be the nicest person that God ever created, but your medical doctor is not trained in health care. Your medical doctor is trained in disease management. So the heartburn is never cured, it's managed. The blood pressure is never cured, it's managed. The depression, the anxiety, the blood sugar abnormality, the fibromyalgia, the arthritis, the asthma is never cured. These things are all managed. And as time goes by, patients under allopathic MD pharmaceutical care get weaker and more dependent on drugs and surgery and sicker as time goes by. And I simply did not want to align myself with a profession that did that. I have a lot of respect for military field medicine. I have a lot of respect for surgeons. A very good friend of mine was a very famous orthopedic surgeon. His name's Dave Janda. That's the wheelhouse of MD-directed medicine. But I didn't want to do that. I wanted to help people get healthy. I wanted to help people recover their health. I wanted to actually try to heal people from their conditions. And so that's why I became a naturopathic physician, because that's what my profession specializes in. When most people use the term holistic, they leave off of the W. They spell it holistic instead of wholistic, which is the correct way to spell it. What holistic medicine means is that the practitioner of holistic medicine, whether it's a naturopath or a homeopath or an Ayurvedic practitioner, an acupuncturist, a traditional Chinese medical practitioner, whatever it is, it means that we take a broader view of the situation and we attempt to assess the root cause of the problem. You know, if you go to a medical doctor, you're going to spend 5 minutes with the doctor. If you're lucky, the doctor is going to give you a pharmaceutical to treat the disease. So everybody with asthma gets the same thing. Everybody with high blood pressure gets the same thing, unless they have an adverse reaction to it and then they get something different. But it's a checklist. And a computer could do it. I don't even know why patients need to spend any time with the medical doctor at all, quite frankly. In a holistic physician's office, it's a very different thing, because we talk about your mental state, we talk about your diet, we talk about the stress in your life. We do a symptom inventory that would make most medical doctors, it pales in comparison to what a medical doctor does. And so we collect an enormous amount of information, mind, body. We have the patient articulate their symptoms in detail in order to create a comprehensive health recovery protocol. And by the way, this is a very interesting thing to talk about. Naturopathic doctors don't treat disease. We treat people. And there's a gigantic difference. And when you treat a person instead of a disease, you must, therefore, by definition, do it holistically.